What's your name, sir?
Dr. Rohan Delia.
Dr. Delia, it's an absolute privilege and honor to meet you.
Likewise.
I'm Dr. Bhagat Makijani. I'm a PhD in law. And I believe that you've been saving patients' lives since a long time. So could you share some tips and suggestions for our new generation, how they can prevent diseases in the eye in the first place, since prevention is better than cure? Your inputs on the same.
So it's very individual to the age group that you're targeting here. The younger age groups within the bracket of say 10 to 30 years of age, because as you are aware, the screen time has gone up. So that itself causes or serves as a risk factor for myopia, which is a refractive error that requires them to wear glasses to circumvent that. Another thing is outdoor sports or any outdoor activities. That is another protective factor from preventing refractive errors. So these two simple tips can help children in the school going or in the college going bracket to prevent refractive errors. Moving forward, then you look at people who are in their 40s, 50s, 60s. So there you tend to come across people who are having systemic conditions. Could be diabetes, could be hypertension. So the majority of these systemic conditions manifest within the body only after a point when the condition has progressed to a significant level. So the eye is a very sensitive organ that shows manifestations of systemic conditions at a very early stage. So doing a routine eye exam alone can help detect diabetic changes, hypertensive changes at an early stage. So doing just a yearly checkup will help the patients identify conditions sooner and likewise then get treated for the same. And there are certain conditions like glaucoma, retinitis pigmentosa, refractive errors of pathological levels like very high myopia, which they all carry a certain hereditary component. And so if you already know that your parents have a certain ocular condition, it wouldn't harm to come in for a routine exam just to see how your eyes are doing. So these are just a few tips that you can keep in mind, and
That's really interesting. So I at an individual level have been coming across this concept because medicine is so complicated. We have retinal hemorrhages, scleral buckling, cataracts, aqueous these complex procedures which the layman is not educated and aware of. So I want to create awareness of this concept if all patients, if they're educated by their doctor and encouraged by their doctors that, whether it's your maid servant or it's your driver, you spread some awareness, you just put around 2 or 3 minutes in a week of your time and you look into their personal issues and you advise them to get medically checked up and visit a doctor. Do you think that can make a difference in society and help in saving as many more lives as possible?
Absolutely. Spreading awareness is probably the grassroots level activity that we can do to educate people. And then once people are educated about their conditions and likewise the treatment modalities that will help,
right, that
in itself is half the battle won.
Right. That's wonderful, sir. And one last question for you is, these days patients, they're very afraid of side effects. So those who come from medical backgrounds, their kids, they're even scared to undergo an MRI or a CT scan because they feel that the contrast or dye would affect their kidney function, it impacts their glomerular filtration rate, so they're doing MRI, CT scans without a dye. They are scared to take medications which are NSAIDs, like non-steroidal anti-inflammatory drugs, or antibiotics like aminoglycoside for fear of side effects. So do you think that we should have more awareness towards the adverse reactions of drugs with patients, and how do we bridge the gap and build more trust amongst the patients so that they go more frequently for their medical checkups?
Spreading awareness, that is key, but at the same time it's also important to understand that all medications, like you mentioned, that have side effects, they're all decisions. The use of these medications or dyes or any investigative modalities, the use is always weighed against the risk. Now, the benefit to risk rather is the right term. So when the benefit outweighs the risk that is involved, then the use of those things is warranted.
Okay.
But when it does not, then yes, I agree. Then the adverse reactions can play havoc, and so awareness would help in those situations. So.
Okay, sir. So we'll end this with a note that you encourage all your patients to give up a sedentary lifestyle, give up tobacco. Prevention is better than cure, and also with encouraging your patients to help underprivileged people, whether they can pay directly at the hospital or the nursing home, or whether they are undergoing treatment. We believe that this can help in saving substantial amount of lives. And I'll just say one quick mantra, which is from the goddess of healing, Dhanvantri, and we'll end this conversation. Om Asato Ma Satgamaya Tamaso Ma Jyotirgamaya Mrityorma Amritam Gamaya. Om, lead us from the unreal to the real, lead us from darkness to light, lead us from death to immortality. Thank you so much for your time, sir. It's an absolute pleasure. That's it, Juliet.